Digital health is two things, and they're coming from different directions. From within the healthcare system, digital health is about doctors and hospitals and all the other workers and facilities using new digital tools to do their jobs better. Perhaps more interesting is coming from outside the healthcare system. We have solutions entrepreneurs who never thought they would be in healthcare, realizing that they now have the ability to create something that would be really useful to people and improve their health. And these things are colliding a little bit. They are against each other, but increasingly they're learning how to collaborate, and that's when the real magic will happen. I'm not sure if there's another area where we have the combination of a tremendous amount of data and so much learning that we haven't yet done from it. Healthcare is a very traditional field where we rely a lot on the experts and their opinions. And it's actually quite new that we're beginning to understand that experts don't always know everything, and that we need to combine our human expertise with the ability to learn from data, and not just the traditional, slow, expensive, randomized trial, but also the data that we can now collect in massive, efficient ways. We're really beginning to see a revolution in healthcare because of the presence of large data sources and our technical and cultural ability to learn from them. Well, my time at Google taught me many things. One is that one has to be willing to take risks and do things where failure is quite likely, because otherwise you're not trying hard enough to discover or create the next big opportunity. The other is that there's no such thing as a one-man show, but how much multidisciplinary approaches to things are critical. Before my work at Google, I had really only worked inside the healthcare system, and combining the creativity and the knowledge, the problem-solving abilities of people from different disciplines to, in my case, help solve healthcare problems, taught me that I will never again be willing to work on a team that isn't multidisciplinary. It's short-sighted and doomed to failure. The internet is beginning to help make healthcare more transparent. The problem, however, is that unlike restaurants, where it's pretty easy to put not only reviews, but the menu with the costs online, in healthcare we can't do that because we don't even know the costs of the care we're providing. As a practicing physician, when I order a test or a medication or make a referral, I actually don't know what the cost of it is. That's essentially hidden from me, and only in the hands of certain administrators or bureaucrats, if I can use a more charged name. And so we still live in a world that's inside of itself is not transparent, so we're limited in our ability to make it more transparent. I think one thing the internet is doing is pointing that reality out and making more of us realize that we need more transparency in healthcare because we now have tools and a culture that demands it. But it's going to take us another decade or so to get to the place where other industries are today. I'm not sure that we are too close to seeing a Tripadvisor for healthcare, at least not a good one, because healthcare has some very important subjective and some very important objective components to it. If I'm going to have a procedure or another healthcare experience, I want to feel comfortable doing that procedure, having that procedure done to me. I also want to make sure that technically the result is good. Tripadvisor works very well for the purely subjective experiences, like how will my experience in a hotel be? But from an objective place, it's not so important to note exactly how many hours of good quality sleep will I get in that bed. Healthcare, on the other hand, I not only care about my subjective experience, but I want to know objectively that I'm likely to survive and become healthier depending on the nature of the procedure or the intervention. And that's something we don't actually have good data for yet. Digital health is beginning to and will dramatically change the way that we practice medicine. I expect that in the next 5 years, I will more often be prescribing a digital health intervention, for example, for depression, than a depression medication. And that's not because we have such amazing digital health interventions coming, but we have some new ones. And antidepressants only work okay. So the bar is low in many cases, and many people would prefer to have, for example, digital counseling or a virtual reality intervention to help them reduce anxiety about how they feel in certain situations than to take a medicine that has side effects and an imperfect success benefit. So I think digital health is going to explode as we begin to measure its impact and as the practice of medicine begins to embrace digital therapeutics as a legitimate kind of thing to prescribe. Unfortunately, I don't think we can be assured that they won't get into the wrong hands. Just like every other kind of data, we have great security and we have great hackers, the bad kind of hackers. So instead of pretending that we can make any data set completely secure, I think we need to be really thoughtful about what kind of data we collect, how we make people aware of the way that we're collecting data, and make sure that they are agreeing to whatever we're going to do with the data, which means that we have to do something for them that's so valuable that they're willing and comfortable taking the hopefully small risks associated with it. But it means that we have to have the conversation. We certainly need to get better at data security, but I think we also have to acknowledge that we're talking about a new paradigm, which isn't where something is perfectly secure, because I'm afraid there's no such thing. So instead, we have to have a very conscious discussion about risks and benefits and make sure that we're always providing more benefit than risk.